Let's get you an update with regards to the coronavirus. Now, the number of new coronavirus cases in South Africa has risen to 1,897, and another 48 people have died of COVID-19 related complications. The latest report by the Health Department shows that the country has recorded over 712,000 cases since the pandemic began. Recoveries are currently at 643,528, which translates to a 90% recovery rate. Active cases are slightly below 50,000. The country has recorded 18,891 fatalities. So a study conducted by the University of Johannesburg and the Human Science Research Council has found that South Africans are experiencing pandemic fatigue. It's a phenomenon that's believed to be fueling the possibility of a second wave of the coronavirus. I want to get the latest on this survey. Dr. Ben Roberts, Chief Research Specialist in the Development Capable and Ethical State Division at H.S.R.C, joins me now live. Doctor, appreciate your time.
Good afternoon, Blaine, and to the viewers.
All right, so let's tee it up for the viewers. The latest summary findings from the H.S.R.C COVID-19 Democracy Survey. Talk to us about, firstly, the methodology that was used, who was interviewed, when, where, how was the survey conducted?
Yeah, this is an online survey that was conducted with approximately 20,000 individuals in two rounds. The first round was conducted during the hard lockdown period in April through to early May, and the second phase was conducted in early July through to the 8th of September. So it covered sort of lockdown level 3 and 2. So this was a survey that was administered on an online platform called Moya Messenger, and also we made available the link through various channels. So it is a non-probability survey that has been matched as best as possible using Stats.SA statistics to try and profile the demographics of the country. So it gives a very good indication of developments amongst the South African public in terms of their attitudes, preferences and behaviours.
So it's important to establish how this was conducted to give it credibility. We understand that there's a growing pandemic fatigue. I would add, from what I've seen and heard, Doctor, in many other countries, there's a fatigue of forbearance, self-control, restraint, and I guess tolerance. Where's your level of concern regarding the fatigue of fear when it comes to observing health and safety protocols, like washing your hands, wearing a mask, and watching your distance? What are you learning?
Yeah, I think it's one of the fundamental lessons coming from other countries that are seeing resurgent waves of the pandemic. Certainly, and South Africa is a good case in point, is that we saw in the early hard lockdown phase, there's a broad-based recognition of the need to sort of abide by the preventative measures that the government has recommended. And that includes obviously social isolation and the hard lockdown through to mask wearing, sanitizing and social distancing. Over time, we've seen that and increasingly there's been a change in perspective, and I think a worrying sign that's come from other countries that are seeing second waves is that relaxation, the sense of diminished motivation to comply with these basic preventative behaviours. And in South Africa, our survey has shown that the sort of markers are there in terms of certainly in terms of changing risk perceptions, and also a key factor is changing views around the governance of COVID-19. So I think the risk perceptions are particularly stark, and I think that we've seen, especially after the first half of July, a fundamental shift amongst the South African public in terms of their views around the likelihood of being infected in coming months,
right,
which fell from around 40% down to 25% by early September.
Yeah.
The sense that the threat of COVID-19 has been particularly exaggerated. So we see 2 in 5 South Africans, around 41%, by September, was stating that they felt the risk of COVID-19 was exaggerated.
Right. So people are believing that So that's one of the key findings in the survey. People think that it's being exaggerated. What is driving this conclusion?
Well, I think partly it's probably some of the particularities of the South African COVID-19 statistics and pandemic as we've seen. While the cases surged in June, July, we saw relative to other countries our mortality rates were significantly lower for whatever reason. So I think that also fed this idea that the pandemic perhaps was not as worse as it had been made out to be. I think the other aspect is issues pertaining to the sort of economic consequences of the pandemic and sort of a relative weighing up of risk. We've seen through the sizable share reporting hunger and other economic effects of the pandemic, and the enduring, almost universal sense of concern about that over our period of surveying relative to the risk of potential infection.
Right.
So I think it's a weighing up of different forms of risk, and South Africans are prioritising for now the economic security over preventative behaviour.
Doc, as you know, although not a complete prophylaxis, in the absence of a vaccine, medical experts tell us that using a mask will reduce transmission. It's an important tool that we have at this stage. But what's your survey telling you with regards to people and the use of masks?
Well, what we find is that around a third of South Africans say that they're not wearing masks out in public, which is still an alarming share. And of those that are wearing masks, there is obviously the issue about are they wearing it correctly. So mask wearing is a critical basic preventative behaviour that we need to have a strong communication about trying to reinforce. Don't let the mask slip, so to speak, during this time. If we are to avoid a significant surge in case numbers in coming months again. I think the other thing is that we have obviously seen some slippage in views around the governance of COVID-19 relative to the hard lockdown phase. So particularly trust in the president, but also the national government has dropped around 20 percentage points over time, and that in part is also informing this sort of demotivation around basic measures.
The disease, COVID-19, is not the only thing that spreads. Misinformation is very contagious too, as you know. Not only are we dealing with this pandemic, but we're also dealing with something called infodemic, misinformation, the sharing of a meme or a tweet that is factually incorrect. And I guess that can also lead to anxiety and fatigue. People think that they are helping, but it often generates another layer of uncertainty. Do you think that has a part to play in some of your findings?
Well, I think there are a number of aspects to the information debate. I think some of it is about information overload, and I think a lot of international studies, particularly looking at the mental health aspects of COVID-19, have really encouraged South Africans and certainly citizens of other countries to be very careful about the extent to which they are absorbing lots of information. So actually they suggest being quite choosy about the extent to which you tune in to different forms of information. The other aspect is as you said, the fake news or the misinformation factor, and indeed the politicization that we've seen in certain countries around the world in relation to COVID-related information and indeed mask wearing. So I think certainly there's those aspects, but at the same time there's a desperate need now for strong communications campaigns to reinforce health preventative behaviour, particularly tailored to the differential channels and information sources that South Africans prefer. We still see a predominance of the conventional media, the radio, and particularly the television, but also other sources such as online news sites is becoming a particular source for a significant subset of the population. So ensuring that they are getting accurate and information and about the needs in this particular time is going to be critical in the months ahead.
I wonder how, if South Africans are tuning in to how world leaders are reacting to the coronavirus and contributing to any sort of fatigue in any way. I mean, we take a figure that looms large over the world, US President Donald Trump and his attitude and approach towards coronavirus. Does that play a part in how people approach this disease? Does it hold sway, do you think?
Absolutely. I mean, we've seen particularly an obsession around presidential figures and COVID-19 related messaging. I think in the US, COVID-19 has become a particular rallying point for the forthcoming election, and especially the issue around mask wearing, which was highly politicized. In the South African case, we've seen less politicization of aspects such as mask wearing. We've seen politicizing around more the handling of key pandemic decisions, issues about the frequency of communication. Yeah. So although there was a broad-based cross-party support for what the president and his team were doing in the hard lockdown phase, we saw, within a sort of month or 6 weeks of the hard lockdown, that consensus began to fall apart and clear party divisions along party lines resurfaced. Our study shows that those particular divisions also are reflected in party supporters,
right,
which were not there in the hard lockdown phase. So parties have a fundamental role to play in reinforcing certain types of behavior amongst their support base.
Dr. Roberts, we give our viewers the numbers every day, but I just hope that the viewers don't hear it like the teacher from Charlie Brown is saying. You know what I'm saying? We need to be guarded from fear fatigue. If we're not concerned about how these numbers are moving up anymore, then I guess we are at a real risk of the situation getting out of hand. We can only win this war against the virus if we surrender the me to the we. Dr. Ben Roberts, Chief Research Specialist in the Developmental, Capable and Ethical State Division at the H.S.R.C. We appreciate your time, sir, your perspective and your insight. Be well.
Thank you very much.
All right, there you go. So fatigue, real concern with regards to the coronavirus. See what's happening in Europe in particular. See what's happening in France, Italy, Germany. Curfews being put in place. Are we going down that road again? The second wave, the existential threat of this virus is being played out in various parts of the world. So we have to be aware of that as well. Well, the coronavirus pandemic has inspired a new